Welcome to our session today to discuss the Continuum of Care Program 2023 new project application process for the Indiana Balance Estate. Appreciate everybody's time today. Most of what we're going to be covering today is fairly high level, but I've got a number of colleagues and friends on today who can help with pretty detailed questions. Most importantly, our good friend Howard Birchman, who is our consultant and assists us in our application process. True expert in the field of continuum of care program and the NOFA process, especially. So if as we are going through the process and discussing things, you've got detailed questions, we will do our very best to address them. And of course, follow up with any additional needs that we may encounter as we go along. We will also be giving you a preview of the application tool that we are using this year for all new projects. We're not, unfortunately, able to give you much of a look at what's in eSnaps because it's not there yet. But if you are familiar with eSnaps, it, I would assume, is going to be very similar to what we have seen in the past. And we didn't see a lot of additional rating criteria for new projects that we're too concerned about, though, again, we're happy to answer those questions as they arise. I've got some coworkers here, Jim Flatford and Alicia Broda, and my supervisor, Kristen Garvey, on as well. They'll be trying to keep an eye on the chat and waiting room for me as we present, because as you all know, technology is special and sometimes it works and sometimes it doesn't. So hopefully going to have a good overview today and give you an opportunity to answer any questions you might have right now and maybe come up with some new ones as we're going along. Right, let's get going. So just want to briefly hit on the timeline because those of you who've ever been involved with continuum of care know that this is sort of a train that once the gets on track, it just sort of goes. And so we do our best to hop on and be ready to go. But essentially, the process for continuum of care funding for a new project can't begin until HUD launches the funding notice. That was on July 6th this year. And in preparation for receiving new applications, IHCDA staff and Howard and other friends and colleagues reviewed that application notice. And we were able to release our new project application on July 18th. This year, because of our new application tool being new to us, we really want to make sure we're giving folks a lot of support in getting their new project application ready. So we are asking everyone who is interested in applying for a new project to submit a project interest letter by July 31st. And then to go ahead and complete your new project application in our IHCDA Community Services Grants Management application system by August 14th. Projects will be notified of selection by August 31st at the very latest. I would anticipate we'd probably have a good sense before that to help get you supported in moving from our platform into eSnaps. But we are going to look to try and have eSnaps materials in by September 11th. Obviously, understanding we don't have a HUD deadline until the 28th, but often we find that there's significant back and forth with our team, with our consultant Howard, to really strengthen and improve applications after they've been submitted, whether it's in our system or in eSnaps. And what we're trying to do there is really give us as much time as possible to give you the best foot forward in submitting that application. So that's our timeline right now. I anticipate, that we will have, some flexibility around certain parts of this timeline, but and others we're pretty much set on September 28th. We really can't submit later than that. Otherwise, we won't have any applications in, and then we'd be in real trouble. So, if you're having problems, if you have questions, please reach out to us at the community services inbox, and we will do our very best to address your questions as quickly as we can. We do want you to feel supported in this process because we know this is a significant lift for an organization, and especially because we can never start until HUD gives us the notice. It always feels like the deadlines come up sooner than you expect. So just kind of want to briefly go over funding and eligibility for programs and projects, making sure that individual agencies that are interested in applying for funding understand what those requirements are, so that there's no miscommunication on whether or not your agency is eligible to apply. All right, so minimum requirements for an organization. In accordance with HUD regulations, organizations that are eligible to apply for a new project are 501c3s, local government entities, housing agencies, and tribal entities. So we at IHCDA apply on behalf of many organizations. But all of those organizations that are subrecipients of ours also meet this standard threshold. So even if you were considering, applying as a subrecipient, you would still need to be one of these organizational types. You are able to apply on your own directly to HUD. That may be a good fit for an organization that's possibly done this process before. If it's new to you, I would encourage you to speak with us about what your capacity is, because again, as we get into some of these materials, there's a pretty significant lift, especially in the technology side of things to getting into eSNAPs, but also just in the overall management and support to your program that IHCDA is able to provide that we are not able to provide to our direct HUD funded counterparts. You have to reside in the balance of state, so your organization can't have the project existing inside Marion County. If you are an organization that is wanting to serve out of county, please, again, as you're preparing your letter of interest, let us know and explain that so it's clear to us that you are eligible to apply under the balance of state. If you exist in Marion County and your project will be in Marion County, you can go to the Indianapolis Continuum of Care and submit a new project application through their process. I don't know if that process is still open, but I should probably just say that up front so that you don't waste the next 90 minutes of your time sitting in an application webinar for a process that you can't apply through. I want to also just say that, we are looking to partner and support projects that operate under Housing First principles. If Housing First is something that is new to you or you're not familiar with, I encourage you to Google that concept to make sure it aligns with your organizational philosophy. HUD really expects that there is a strong engagement from an agency that receives CoC funding to have lived experience representation on their board. So if CoC is new to you and you don't currently have folks with lived experience on your board, we can certainly have a conversation about what that might look like if you were to receive funding. But definitely want to make sure you know that if you were to be selected for funding and receive those dollars, you would absolutely have to have a member of your board who has experienced homelessness, whether that is through a domestic violence situation or through a literal homeless situation in shelter, street, or other locations not meant for human habitation. So basic expectations on that area there. I also want to hit on a couple things related to financial management. Because there are folks who reach out to us year round who are interested in wanting to support programs that they're operating in their local community, but they may not actually have the financial management capacity needed to operate a federal award. And we recognize that that is a challenge, and we appreciate that difficulty in kind of getting over that hump, if you will, to reach that level where you're prepared to do that. But we don't want you to have an unrealistic expectation of how the grant operates. And how you would operate in your financial management practices, and certainly don't want to put anybody in a risky situation because they weren't prepared to take on the funds. So we would be expecting that you'd be able to follow the 2 CFR 200 regulations and operate with basic accounting principles to be able to operate your award or report your expenses. You should have a well-organized financial management practices with individuals with unique responsibilities for management of finances so that there isn't any risk of misuse of funds. These grants, similar to many federal grants, right, they operate on a reimbursement basis. So this is not funding that you apply for, receive at the beginning of the grant term, and then spend down, as you see fit. You would be, essentially claiming down money after you've spent it and reimbursing yourself for expenses already incurred and paid for. You need to be able to file claims on time. If you're working with IHCDA, this particularly needs to be on a monthly basis because we really are tracking those expenditures to make sure the awards are claimed down. And you have to be able to match your award at 25% from eligible sources on eligible activities. We're not going to dive deep into what match is. I see a lot of faces of folks who receive other kinds of funds, so I'm assuming you are familiar with some stuff, but happy to answer specific questions about match if you have concerns about being able to reach that threshold. What are your required documentations that you'd be submitting with an application? First, we have to know that everybody who is submitting an application is in good standing with the Secretary of State of Indiana, and that you have a unique entity identifier with sam.gov. So we need to be able to see that registration and that you have that ID. I understand, especially as we just went through the ESG process, sam.gov has had some quirks lately. So again, if you're having difficulty in producing these documents, please reach out to us so that we can help support you in that effort, because we do really want to make sure we've got a great pool of applicants coming into the funding opportunity this year, making sure you have what you need to be successful. And we don't want anyone to feel like they can't apply because they're having difficulty with the governmental website. So just let us know if you're having trouble. We'll see what we see on our end, and if there's anything how we can do to remediate that. We are going to want to see that you have commitments for that match of 25%, whether it's through MOUs or through some kind of commitment letter. And then HUD is looking for us, and we are also supporting healthcare and housing leverage letters, MOUs, or commitments. We'll talk more about what that is in a little bit, but please know that that's something that's a really high priority for us. One of the reasons why that's so important is because applications that have that help the our entire statewide application score better. So we really want to support anybody who's able to obtain that documentation, and we'll talk more about that a little bit later. So again, just kind of want to quickly hit on a couple of highlights. Is CoC funding right for my organization? Beyond the basic thresholds of do we have the financial management practices? Do we, are we operating under housing first principles and believe in that philosophy? What are some things that we see from HUD, and how does CoC funding work that makes it different as to why this may or may not be the right funding opportunity for your organization? So the first thing to know, and again, I recognize lots of faces on here, so I know several of you do know this, is that CoC does operate differently than some of our other HUD Homeless Services Program grants. If you're familiar with Emergency Solutions Grant, that is a formula allocation. We get told from HUD what our formula allocation amount is, and then we allocate it out on our own formula using threshold criteria and an application tool. But it's not truly competitive in the same way that CoC is. So while ESG is that formula, we in the Balance of State are not only hosting an annual competition for new and renewal projects so that we have a competitive process, we participate in a nationwide competitive process for funding. That means that we really have a focus around performance and permanent housing outcomes. We ask a lot of our applicants in the renewal process. So if your project were to be selected for funding and placed in the application selected by HUD to receive a grant, you would have a chance to renew that grant afterwards. Renew it at the same amount, or with increases related to FMR, fair market rent. But that does kind of make things a little bit more sustainable. You're not going to see large fluctuations in your award. Barring something tremendous happening, but it is renewable, and so that does give you some stability in your program model. Because it is competitive, though, this is something we do every year, at least for now. We keep getting rumors that maybe they're going to move it out to we won't have to do this every year, every 2 years is something I've heard. But as it stands right now, you kind of go through this process every year. So it can be a bit of a slog, lots of admin time spent on some of these elements to do every year, but that's the expectation that HUD has for us right now. As I said, there's this focus on performance, on permanent housing outcomes, on aligning with kind of HUD principles and philosophies. We'll talk a little bit more about that in a second. So just know that it's not, your evaluation of your project's not just going to be about whether or not you met the basic threshold criteria. It's going to be kind of taking it to the next level. CoC grants, if you're not familiar just generally with HUD homeless dollars, require you to take folks from coordinated entry prioritization. So if you are operating in a region or part of the state and you're not familiar with what coordinated entry is, please reach out to us so we can, get you connected with your local coordinated entry lead. and our staff here that support that work. But just please know that, you know, if you're operating kind of an insular program and you're hoping to create a housing program for the folks you're serving, you know, this coordinated effort to engage and prioritize people for housing may mean that you can't just design a program that's going to serve only clients that you know and see in an existing program you're operating. So just again, keeping that in mind. As a recipient of CoC funding, you know, there's an expectation that you're coordinating with a broad number of stakeholders in your community to address homelessness. It's very much a philosophy of HUD and the U.S. Interagency Council on Homelessness that there's broad coordination across stakeholders and service providers, whether that is those with lived experience, you know, people who have inequitable outcomes. All those kinds of areas are kind of an expectation that HUD sets for us that, you know, we as homeless service providers receiving these funding are kind of taking that to the next level too. Ultimately, I also want to just share, and we'll talk more about process later. I think we just lost power. Did anybody else lose power? No, good. Oh, just my lights. I got panicked. Okay, good. I just got to wave my arm every little while. So one thing I want to make clear is that the decision on whether or not to fund your project or select your project for funding resides with the Continuum of Care Board, particularly the non-conflicted members of that board. So these are organizations that do not receive CoC funding, so they aren't conflicted in the funding decision. But ultimately, this funding list of projects is sent up to HUD, and HUD makes the selection on who receives funding. So it's really about, as we'll talk about later, where your project falls in the ranking of projects that determines the likelihood that you will be selected for funding. Real quickly, just want to hit on, if you haven't had the chance to take a look at materials related to the U.S. Interagency Council on Homelessness, you're going to see a lot of really good information there about why we kind of operate the way we do in homeless services, why we have things like a CoC board and regional planning councils in Indiana, because there's really an emphasis from HUD and our federal partners who also collaborate to address homelessness on creating system-wide responses to homelessness. So again, encourage you to look out in your time to look at some of these resources. Again, a good indication of whether or not you feel like your organization aligns with what the vision is of HUD, and IHCDA is in support of this work and the work we do, and so is the CoC board. So again, just kind of want to remind folks of the resources out there to learn about what the priorities are, why funding decisions happen the way they do. A lot of these strategies, tools, plans tell us why certain things are kind of being prioritized for funding, and why other things maybe have fallen out of fashion. So take a look at those resources if you get the chance. So what can be funded? What can this funding support? First and foremost, CoC, and especially in the balance of state, is a resource for supportive housing. That's permanent housing with supportive services. Those supportive services can be provided by the agency that's the recipient of the grant. They can be provided by a contracted partner. They can be provided as match. They can be done in any combination of those things. But in Indiana, we've really and truly prioritized supportive housing in our CoC funding, and we're continuing to see interest again this year to apply for more of that this year. The CoC program can also support rapid rehousing. Rapid rehousing is a short to medium term rental assistance up to 24 months. Again, if you have the chance to take a look at some online materials, you can look at the programmatic rules around what supportive housing and rapid rehousing are. But those are really the main drivers of permanent housing in the CoC program. And then we have transitional housing to rapid rehousing, which has been in supported housing intervention, especially for core populations like survivors of domestic violence. We've also seen this with youth and young adults and some other kind of key populations that benefit from the safety or structure of a transitional program in combination with rapid rehousing resources. The eligible expenses of what can be paid for in the grant for each of these are outlined in the notice and obviously in the federal rules about the program, which again, if you Google Continuum of Care, I can put a link in the chat, but if you Google Continuum of Care eligible expenses, you'll be able to see the kinds of things that can be expended. When you go to actually build your budget inside the program, you'll have a chance to fill out that detail. But, you know, if you're just kind of curious right now whether or not what you've got in mind is quite the right fit, I'd encourage you to look up those federal rules about those eligible lines. It can also pay for homeless management information services. This is eligible for the HMIS lead only. IHCDA is the recipient of HMIS lead funds. So while you will see in the application an opportunity to add, you know, funding to support HMIS in your program and how you administer it, generally the full HMIS grant is only eligible for that HMIS lead. Similarly, supportive services only coordinated entry funds are available, and those are for the coordinated entry lead agency. Okay, so we're going to talk just briefly about application types because I think there can be sometimes some confusion here on whether or not if you are interested in funding it, whether or not you need to apply. If you are a new project that is going to be standing alone, it's going to be its own contract, its own grant, then obviously this is you're at the right place. You're applying as a new project. It would be its own distinct contract when you receive that funding. It would be its own distinct award. If you are thinking about adding funding to an existing grant, then you'd be applying as an expansion. So that is considered a new project. You complete all the sections that a new project completes with the idea that you are expanding funding to an existing grant so that if that funding were awarded, you would be able to just essentially add it onto the current contract. So this is an expansion of CoC funds, not ESG or some other private funder. It's an expansion of the grant, the award that you have already. And then if you are currently receiving funding and you are thinking you want to change from one program type to another. So let's say I am a rapid rehousing project and it turns out the clients I'm serving, the way I set up my project, the way my organization operates, a supportive housing project is a better fit for the work that we're doing. You could apply to change your project type from one to the other. And again, you would go through the new project application process as if it were new, because it truly is kind of you're submitting it as a new project to HUD. If that transition were to be approved, we can, you know, speak one-on-one with folks that have this kind of special circumstance, but essentially it would, your grant would be replaced. It operates as if you are essentially completely reallocating the project, giving the project up and reapplying for that funding again. So if you're kind of in that boat, if it's something you're thinking about, definitely reach out to us and we can set up, you know, more time to talk about what that process looks like as far as the implementation goes. But as far as how the project application process goes, it is treated as a new project to HUD. So those are the kinds of funds you can apply for. Those are the types of project types that are there. Now, how are you going to be evaluated? First and foremost, both in what we evaluate here in the balance of state level and then what's evaluated by HUD is this allowable and is it truly eligible? So if you, for example, say that you're applying for a supportive housing project, but what you're writing in your narrative about what you're going to do and the types of things you're going to use the grant to do sound like an emergency shelter, HUD and the balance of state are going to have a lot of questions about like, wait, is this actually what the project is? So first and foremost, I don't feel like I should have to say that, but sometimes, you know, we see things come through where it sounds like somebody is really wanting a funding source for their really cool idea, but unfortunately it just doesn't line up with these boxes that we have from HUD. I wish we had more flexibility too, but it is kind of, we're operating within the framework we have. So, you know, you just want to make sure that as you're describing how you're going to operate your project, you're talking about things that are allowable to be expended under the grant. Similarly, are you describing a project that is in alignment with HUD's really core principles of CoC program? Are you using housing first language, or are you talking about having a lot of requirements for program participants? If in your narrative you're talking about requiring sobriety or you know, not allowing you know, certain household types to be allowed, you know, beyond just one bedroom homes, right? You know, if you're saying, well, you know, we'll refuse to serve folks who have an addiction or people with mental health, this is not going to jive with your application process. So just kind of want to forewarn you, we are reading these narratives, HUD reads these narratives, and if you're talking about stuff that is not in alignment, you're going to have some trouble scoring well on your application. And it may be that, you know, you're just going to find that you're not, your project is not the right design for this funding stream. HUD has a really big focus on, especially as currently, really around fair housing, reducing racial disparities on equity work. We have tried to infuse that into our new project evaluation process. And I would anticipate seeing projects from or questions from HUD as well in this area. But it's really important to kind of be thinking about those topics as you're completing your application, because it is a kind of a core mission of HUD right now, especially fair housing and equity work, to really make sure we're making sure folks have access, that there's not discrimination happening, things like that. And then there's going to be a focus on coordinating with other systems. Are you offering lots of services to folks? You know, it is a housing first program, but it's not housing only, right? So how are you creating connections and building that support network for people in your program, so that eventually they have that stability? You know, are you helping them get income? Are you making sure they have, Medicaid access, all those kinds of things we do in homeless services work? You're going to want to talk about that in your application. That's going to be something that we're looking for at Balance of State, and HUD's looking as well. There are questions in there about financial management practices and controls. I highlight this particularly because we actually have had a lot of difficulty in kind of getting comprehensive answers around this area in the past. So we've asked additional questions this year in the new project application about financial management practices and controls, so that we can get a clear answer in our new project applications to HUD on what folks are doing, so that HUD feels like organizations are prepared to take on the financial responsibility. If you are a project that is either thinking about a new project or expanding a current project that is serving individuals who are survivors of domestic violence, there is special money and that we usually use for that population that's a part of this competition. It's called DV bonus funding. And there are some additional questions you're asked if you're applying under DV bonus. They're going to ask you even more about why we need the project. What is the data, the hard numbers you have for survivors of domestic violence in your community. It's the application questions focus a lot on making sure survivors have access, and that projects are doing all they can to reduce barriers for survivors to accessing housing and resources. And then in particular on how projects support safety and housing stability for survivors after they're in their units or in their program. So if you are thinking about domestic violence projects, if you're thinking about applying, we will likely look to put you in with domestic violence bonus funding. And there's some additional questions that you'd be asked. If you are interested in domestic violence bonus funding, please reach out to us now, because we are kind of organizing a consortium of folks right now who have expressed interest in additional funding. And it may be that it would work out well for you to participate in a collaborative application with other applicants. So just reach out to us in Community Services inbox, and we'd be happy to talk with you about whether or not that type of application would be a good fit for you, or whether or not you'd like to go out on your own and apply. Either one is obviously your choice. And then there's also an ongoing focus, and we've seen this the last couple of years, on a housing and healthcare partnership. And that partnership is really focused around demonstrating a specific level of collaboration between the service provider applicant, or the applicant, and a housing or healthcare entity. And I'm going to talk a little bit more about what that means in a moment. This was definitely a hot topic last year. It was difficult for us to figure out exactly what HUD was wanting with this, because it's been fairly new in the last couple of years that they've been asking for healthcare partnership. And what we see in the notice, what they're telling us in the funding opportunity, is that there is an expectation that there is either a substance use treatment provider or a healthcare provider that is willing to partner with your organization. HUD prefers, and we prefer, in order to help you get those points that you're looking for to score well on receiving that partnership, recognition, that it's a fairly formalized commitment letter of some kind. It could be an MOU, an agreement of some kind. But if you cannot obtain that for a variety of reasons, even a support letter is probably better than nothing. The notice does say that partial points can be awarded. There's kind of two pathways to go for this. I'm first going to talk about substance use treatment access, and then I'm going to talk very briefly about healthcare in kind. And Howard, feel free to jump in here if you want to contribute any of your expertise in this area. But essentially, What we have seen is that the substance use treatment access, leverage or collaboration or partnership, if you will, is really just about providing a letter from the substance use treatment provider that says that any client or program participant that is enrolled in your housing program, in your rapid rehousing, supportive housing, TH2 rapid rehousing program, if they would like and are eligible to receive substance use treatment services from that provider, that they can receive them. So that's a fairly open commitment, right? It does not get very specific into dollar amounts, and it doesn't get very specific into really any numbers at all of clients, of services or anything. So it's a fairly broad support letter. If you are interested in seeing a copy of a substance use treatment support letter, we can provide one to you. Howard has graciously located one that got another balance of state points on their application, and that recipient of funding points on their new project application. They had a letter in their application last year that met the standard for substance use treatment access partnership. If you are thinking more, maybe because of what your agency does or who you're already partnered with, that some sort of in-kind partnership with a healthcare provider is a better fit for you, then specifically your letter or commitment is going to need to describe how the funds are being, they don't use the term match. What they use is leveraging. So you need to be able to leverage 25% of the funding you're requesting. The information HUD is looking for needs to have detailed dates and value of amounts. So just to kind of walk you through what that might look like, obviously you don't necessarily have dates yet because you don't even have clients because you don't even have the program. But if you were to, say, anticipating that if awarded this funding, you would start in July of 2024, that you could then say in your letter between the dates of July 1, 2024 to June 30, 2025, we, this healthcare partner, will commit to providing, 25 hours of licensed practical nurse care, 30 hours of, licensed clinical social worker, and something at least that detail level. Again, you're not going to be able to provide like on July 13th, someone's going to get a doctor's appointment, right? That's not going to work, but they're going to want to see dates, values, and amounts. So whatever the value of that social worker's time is, that doctor, that nurse, whatever that value is what they're looking for. Howard, do you have anything to add about this? One thing I got last year was whether or not just doing like Medicaid-based outreach, as in like getting people signed up to get Medicaid or things like that, was that eligible as healthcare in kind? And I don't know that is or isn't.
If it is a service that's going to be provided, especially by a federally qualified health center, and that is reimbursed from sources that are to that health center and not through the CoC, then I think that would be qualified as leveraged healthcare services because it's provided by a healthcare provider with non-CoC services.
Yeah.
But you're correct. It is that the healthcare leverage really does require a specific dollar amount associated with it, along with the fact that there's every likelihood that HUD is going to want to look at the back end. We're providing a commitment at the front end. HUD often looks at the back end to make sure that what was committed actually was delivered as well. So there is likely some additional record keeping associated with that. Yeah. And as you said, the substance use treatment commitment is easier because it doesn't have a specific dollar amount, nor a specified number of participants either, just that every enrolled participant who chooses to participate is able to do so and is eligible.
Yeah. Hey, Pam, I see you have a question. What's up?
Sorry. So Howard, follow up to that. We, as a Covering Kids and Families organization, I have staff that provide Medicaid outreach and enroll people into all of Indiana's public health insurance programs and the federally funded marketplace. Okay. So would that be too complicated? I mean, we're not a federally qualified health clinic. We receive Medicaid administrative funding match to enroll people into Medicaid. And I have to raise half my budget by private donations.
So it's essentially that kind of healthcare navigation service
Correct.
of navigating them to
Correct.
to
But you know, we're
providers.
not clinical, we're not
Yep.
clinically certified. We are, all my staff is, oh crap, they all have insurance licenses and navigator certification, because the state of Indiana requires it.
So, Pam, while Rachel continues doing on her thing, let me go back to the NOFO and
Okay.
parse the language to
Okay.
see to see if there's anything in their language that gives us better insight into your
Okay,
question.
I tried this with the new NOFO back in the fall, winter, and that didn't seem to matter much. So I just wondered what I could do to improve, if you think it will qualify.
We'll be back.
All right, thanks.
Thanks. That's a really great question, Pam. One other question I had too, and I apologize, Howard, for interrupting your research, was if somebody is an FQHC and they're applying for the CoC grant, could they use one side of their house to be the leverage for this side, right? Okay, that's allowed. I didn't read it, that wasn't allowable. So I wanted to check, because I know we have a number of folks who are community mental health centers on here, federally qualified health centers, and want to make sure that that was clear to you. It doesn't have to be a outside entity per se. It just has to be something that's not being paid for by CoC funds, that is providing the support for that leverage.
Yeah, I mean, I'm looking. It says from a healthcare organization, and then it talks about healthcare resources. So we'll parse. So I mean, it doesn't say from a separate, a distinct healthcare organization. It just says from a healthcare organization. Now we're going to research what healthcare resources means a little more.
Always more to research. All right, we'll check back in with Howard in a few minutes.
Howard, research what they mean by a healthcare organization.
There we go. Okay, so I mentioned also a housing partnership. This is something we've seen HUD prioritizing for a little bit longer than the housing or the healthcare partnership. This does very clearly say, formal commitment from housing subsidy provider. Again, it does say you can receive less points if you don't quite have that formal commitment. But the idea is that in the number of actual units you're applying for in support of housing, that there would be 25% of those units that would be supported by a non-CoC or ESG subsidy. And so typically we would think of those as housing choice vouchers. That probably the first place most minds would go. It could be non-elderly disabled vouchers though. It could be foster youth to independence vouchers. So if you're operating in a community that has its own housing agency, this is a great opportunity to go and speak with them to say, I'm applying for funding that includes units and services. And would you be interested in kind of coming alongside this application with, if let's say you're applying for 10 units with 2 or 3 units for your program. The balance of state does not have a threshold for your program size, and we can talk a little bit more about how you decide how much to apply for. But there's you can apply for 10 units, you could apply for 200 units. It's really up to you on what your organization is going after. With rapid rehousing, because the program model is not tied so much to an ongoing permanent rental assistance to the same person. It is 25% of participants is how the language is written. So that 25% expectation is there. We're really looking for folks to go after healthcare and housing partnership. So please, if you are thinking about applying this year, definitely start getting the wheels turning and chatting with those other partners in this area, knowing that obviously you may not be able to have everything by August 14th. But if you can be nearly there by the end of August so that it's ready in September, then I think we'd be in a great position. Again, this is how some of this becomes a little bit of a conversation, because our application is going to ask you for some of this documentation. And if you don't have it, but you're working on it, we want to know that so that we can be supportive of you and make sure the board of the CoC understands that as well. Yeah, what's up, Pam?
Okay, so what happens when HCDA is the housing subsidy provider?
If you're applying and the housing subsidy provider is us, as in the other side of our house, because that's not me, thank goodness, that would be way more on my plate than I need. but let's again have a conversation, because what we'll likely do is if you're operating in an area where balance of state is the subsidy, the housing choice voucher, or the Section 8, or grant, the housing agency, we'll likely try and coordinate all of that into a single letter request to Jeff. And so that we're not all having you guys send him like 15 different requests. So again,
And Jeff is leaving, right?
yes.
Okay.
Yep. So we will make sure that we're getting the letter requests to the right person, depending on when the dates of all this happen are. So I appreciate you bringing that up, because that's a really good question. I know that if we can make the case and the rationale to our friends and the real estate team who operate the voucher programs, that we can make a dent here. And I feel confident in being able to have that conversation and be supported in that if that's what people are going to go after. So just as we kind of wrap up this section on expectations, how the application is kind of looking this year, just want to hit on a couple of things. I think I've hit on most of these already, but just kind of want to reiterate, as we read the application for the full application, not the new project application, but we see ongoing emphasis on these areas of housing first, on reducing barriers to housing, engaging individuals with lived experience, and addressing disparity in fair housing issues. So that is a theme in the overall information we're going to be submitting to HUD, which I think means that there might be some questions that are asked about that. I certainly know in the new project application that the balance of state has released, these areas are highlighted. So keep that in mind as you're thinking about that. We'll hop into the application here in a little bit and you'll be able to see it, but keep that in mind. DV bonus funding, as I referenced before, is a part of the competition. And I want to highlight a couple of things that are kind of unique about domestic violence funding in this year's competition. So we see here that not only is that funding there, so it's a set aside pot of money, which you'll see in just a moment, that is dedicated for domestic violence projects. You do not have to be a domestic violence service provider to apply for DV bonus funding. You just need to be, strictly serving survivors with that funding. So the DV, the survivor definition, the survivor domestic violence definition was expanded in the VAWA 2020 language or 2022 language, so that it includes folks who have a history of trauma related to domestic violence. You can read the full detail of that language in the NOFO. They list that out. They list the DV definitions there and stuff, but just please know that that may mean that your project, the population you're serving, may now be eligible for the DV bonus funding, when in the past you may have only applied for regular CoC application funding. There's also a new line item in the budget that is related to coordinating and facilitating emergency transfer plans for survivors of domestic violence in support of their confidentiality and the compliance of emergency transfer plans. So we don't have a lot of detail on what exactly that means yet. I've had questions from folks on, oh, would that mean it could cover things like this or that? And unfortunately, we just don't know yet because it's new and we have not gotten any further guidance on it. I can tell you it's something that we are exploring with our DV bonus funded partners from past funding rounds on whether or not we will maybe apply for an expansion, for example, for DV bonus funding, if that's something that the providers are interested in. But it is related strictly to facilitating emergency transfer plans for confidentiality and compliance. There's also a new funding line item that is eligible in rural communities. If you applied or looked into it all, the special notice that happened last late summer, early fall, you'll know that there was some a line item that was eligible under something called capacity building that could support some different kinds of expenses than we typically see for CoC. And again, you can look in the notice itself and see the detail on that. But it's really kind of cool. It's kind of different money that we haven't seen before. Unfortunately, again, haven't gotten any more guidance on that one. And I really hope we do, because we have projects starting in October that are going to want to use that. But it does support things like a hotel motel stays, some funding for unit repairs to help get them up to housing quality standards. And then also that money can be used to help train staff, retain staff, to support our partners in rural communities. I will say the one thing it's not specifically, we don't have the list of counties in the notice, but I would assume that if your county that you're operating in was eligible under the special notice, it could be eligible for this particular line item. It's not a special pot of money. It's not a new funding bucket. It's just a line item in the budget. So it's not going to operate like DV bonus at all. It's just going to be eligible for those projects that are operating in those counties. Again, if this is something you're interested in, it's one reason why we are asking folks for this letter of interest, to make sure we know who's applying and we can help guide them through this process. We'll definitely speak with you about this line item if it's something you're interested in. If you happen to go in and put money in that line item and we realize that your particular counties don't qualify as eligible, the rural counties, for these extra funds, we'll definitely have that conversation with you about it, because it is weird and different, but it's great that we're being offered this opportunity to apply for these funds and do something a little bit different with CoC funding, especially in our rural communities that have so few resources to serve, especially unsheltered populations or have limited shelter access. So, and then again, those projects will have the expectation to partner with healthcare or housing agencies. If you are a current CoC recipient, just know, I wish we could let you all demonstrate all your great partnerships, but unfortunately they only give us points for the new projects. So we're not going to be asking for anything from any of you for your renewals. This is only for new projects that the housing and healthcare partnerships are available. So how much money do we have? Well, we just found out yesterday, so hopefully the numbers are right, because I think Howard was doing some math for HUD and found maybe some errors, but maybe not on ours. I don't know. They do a lot of math over there, and we might have found some mistakes. But we the continuum of care program is competitive, and I'm trying to use pretty broad language so that I'm not using confusing terminology. There's lots of special language we use in continuum of care competition time periods, but just trying to use broad language possible. What we've received information is that we have an estimated renewal of about $19.1 million. Of that total amount we could renew, because again, this is a competitive process, HUD is only really protecting about 93% of that. So it's about 17.8 million, just under 17.8 million, that when we go in to apply, will be in what's called the top tier, the tier 1 of funding. Anything that falls below that 17.79881 will fall into that second tier of funding, and that is where funding is at risk. So we may have some new projects that fall, we will have new projects that fall into that second tier of funding, because we only have about $200,000 that I'm estimating in reallocation. Reallocation is funding that's being given up voluntarily or involuntarily by current recipients of funding. And our board is actually going to be finalizing whatever that final amount of reallocation will be, so that we can decide what projects that are new are going to get funded with reallocated money versus what's going to get funded with bonus funds. So speaking of bonus, we have just over 2.1 million in opportunity for new projects. So when we think about that, a giant listing of all the projects that are applying for funding, that bottom portion of funding, we can add another 2.1 million at the bottom of that could, boost up our new projects and get a new project in there for us. So very exciting to have that opportunity, hopefully to get a new project with bonus dollars. DV bonus is its own separate pot of competitive funding. So again, if you're applying for a domestic violence project, we will likely engage you in the DV bonus funding, because it is the competitiveness of that funding operates differently.
Balance
I'm
of
trying not to
state,
get
it's the
too
continuum
complicated
of
into
care
it,
we're
but it's
thinking
really
about
just
going
about
for.
trying to give you the best opportunity we can.
Sarah
to
goes
be
for it,
funded.
we get it. It's a big deal.
Oh. Somebody have a question? Okay, well, if you have a question, don't hesitate. I know I'm kind of clicking through some stuff. Okay, so just want to quickly highlight on the funding process and how decisions are made about who's selected for funding. So for you as a potential new project, essentially just kind of walk you very high level through what the process would look like. You hopefully are going to decide what your new project is going to be. I'd encourage you to do that before you apply so that you're not trying to do those two things at once. And then you're going to go ahead and complete the new project request for application process. So that's going to first include that letter of interest to let us know you're going to apply so we can help get you into the system and all set up with your new project application. You are going to have to prepare information about the number and types of units that you want to apply for. So particularly talking about size. So are you going to be serving only single adults in your project? That's fine. But that means you're not going to be requesting funding for 3-bedroom apartments, right? If you're going to serve families and things like that, that's when you'd be looking at, okay, I'm going to have 5 1-bedroom apartments and 10 2-bedroom apartments. I'm just kind of throwing out language. Obviously, it's about the unit size, not necessarily whether it's an apartment or not. So that budget information it goes alongside that unit information, and that's submitted in your new project application. I would anticipate that we're going to have plenty of funding available for folks to apply, and we want to make sure that everybody who who scores well and meets the eligibility is included with that eSNAPS application process. So you will be notified if you're not going to be asked to submit a project into eSNAPS. And if you are going to be submitting a process into eSNAPS. The project application in eSNAPS, if you're working with IHCDA, we will do that for you. We'll work with you and complete that eSNAPS application. If you're going to apply directly to HUD and do the HUD compliance and all that, then you will do that directly inside your own eSNAPS portal. What's good about the eSNAPS portal, I guess, and the application process is there are questions that match between the two systems. So realistically, we hope that people can take the application responses from the application we're providing to select projects for and put that into eSNAPS. There are some required attachments. You know, as a new project, you do have to be able to demonstrate your match and things like that. And so those are going to be uploaded into that system as well. And then kind of as I mentioned, we typically have gone through a process with new projects to correct eSNAPS information, to work with you to review that and make sure we're putting our best foot forward in your application. And then we'll go ahead and submit those projects. So there is a process in which your project is ranked. You will know your ranking before you go in, for eSNAPS is finalized, so that you can make an appeal or do anything you need to do. There is a set of policies and procedures about how to appeal a decision if at any point you need to, and we're happy to provide those to you. They're currently on the IHCDA website, and we're happy to review any appeals that are necessary and pass those on to the board as needed. So there's always that opportunity to appeal. If your project is not selected for funding, and you appeal that decision and the CoC board ultimately still decides to not include your application with the collaborative application that the Balance of State is submitting, there is also a process in which you can submit an application directly to HUD for your project. That is all outlined in the notice if you need to do that. But just know that we're here to support a compliant and transparent process around appeals if that's something that needs to happen. So just want to kind of clarify really quickly, a new applicant is the project sponsor, and we at IHCDA are the collaborative applicant, and we work with the Continuum of Care Board. So these are kind of the 3 big partners in the competition process for CoC funding. If you are a project sponsor, if you're going to apply as a new project, you need to complete the stuff on the previous page. And then you need to make sure that everything we're submitting is correct and accurate and reflective of what you're doing. It's like I said, it really is a collaboration between our team and applicants to make sure all of us are putting our best foot forward. We as collaborative applicants, we read that big long notice and create a process to apply for funding that's compliant. We host the new and renewal project application process. This is the new project application process, so we're in the midst of that. We create the responses and submit the responses for the full collaborative application. So as there are all these new project applications, there's also this other big application we're applying for that is another kind of giant part of the process. But We do that as a collaborative applicant on behalf of the balance of state, and then we then hit the submit button at the end of this process. So whether or not you are directly applying to HUD or you are going, selected for funding and entering into eSNAPs yourself or working with us, ultimately IHDDA is still the one that hits the button at the end because we're the designated applicant on behalf of the balance of state. And finally, the CoC board sets policies as it relates to the competition for funding. They are responsible for managing the conflicts of interest so that there's no conflict when somebody votes on a funding decision. They also determine and approve the reallocation and review and approve the project rankings. So projects that are ranked in order of their score on the application, those are ranked highest. Those that have the lowest scores are ranked at the bottom. And ultimately, the board makes the decision of exactly how all of that falls and what gets submitted as the project listing up to HUD. So wanted to just also briefly touch on what a project ranking means. So projects that are a new project and a renewal project, everybody is ranked in one big list. So last year, I think we had about 82 or 83 projects that were ranked all the way from the #1 project to the very last project. The projects that are at the top, those are the projects that scored the best on the funding applications. Those are typically renewal projects because they have the most experience in doing CoC work. But we do have new projects that have been in the tier 1 category as well. The projects that are ranked the lowest in that big ranking list are typically the most at risk for not being selected by HUD. So even though the CoC board has reviewed and approved a list of 82 projects, we may only have 73 of those projects selected for funding. That's just how CoC program funding works, because HUD ultimately makes the decision of what of those ranked projects are funded. The only caveat being that the domestic violence projects for the DV bonus can really be ranked anywhere. I'm not going to go into detail on why or the philosophy of that, but essentially that money is set aside for them. So even if you're a DV bonus project and you're at the very bottom of the ranking, if you are coming from the DV bonus pot, it's its own separate pot of money. It's protected there, so it's not the same as a non-DV bonus project at the bottom of the ranking. I'll just leave it as simple as I can at that. All right, so we're going to jump into the application and just quickly want to again touch on the timeline here. Please submit your new project interest letters. If it happens that it's August 2nd and you haven't submitted that interest letter, just reach out to us. It's really just more about us setting up this timeline that's reasonable to give people enough time in the new project application. That August 14th deadline is going to be pretty firm for us. So I don't anticipate us moving that. We like to keep firm deadlines. We will then have to review and score all of the new projects we receive so that they can be included in the rankings. So we can't really push this too late into August because then we're going to run up into our deadlines, right? So just please know that, if you're having an issue and you can't get us your letter on the 31st, I'm willing to, be flexible on something like that. But as we get later into this process, the flexibility really goes away. So if this isn't something that's going to work for you this year, we kind of understand. It's obviously comes up quick on us and sometimes takes a lot more planning than what you may have time for in your calendar. The last thing I'll just say is I didn't say this, and maybe I should have just said that at the beginning. This funding that we're applying for now, we will probably receive the notice about whether or not we received it in December or January. That's my hope. This last year, I think it was March or April. But usually we hear in December or January about the projects that were selected. And then the contracts or the grants start in 2024. So we're always kind of operating a year ahead. And so that's the other thing to keep in mind. If you're looking for something to be pretty immediate, CoC program as a new project is not, unfortunately, that type of program. Before we hop into the application, does anybody have any questions?
Hey, this is Dale Bliss from Kokomo.
Hi there.
So our projects in Wabash leave a gaping need for housing for single dads. Bottom line question, would something like that qualify?
You can't restrict by family type, so that would be my concern. Yeah, that would be my concern. Now, certainly, if you wanted to have a project that served household with children, that is definitely allowable and eligible, but restricting by the household makeup would be against a fair housing.
Yeah, okay. So that's kind of what I was thinking. So just expanding our current inventory of supportive housing with that. Right now
Yeah,
we do it under ES.
Yeah, if you are wanting to have more supportive housing in your community, the CoC program is a great way to do that.
Okay.
CoC program does allow funding. Allowable expenses do include, expenses to build buildings. CoC program doesn't have a lot of money to do that, though. As you saw, we really only have a couple $1 million total. And so I would encourage you, if you're kind of looking at building supportive housing, to look at the Supportive Housing Institute that our colleagues in the real estate team lead, because that really involves how to set up your project to get the tax credits and other things that can really help you build. But CoC program does sometimes come alongside those projects to maybe provide some funding for the building, and then on the ongoing project work that is happening with rental assistance and services.
Okay, very good. Yeah, that was the thought that I had, but I just wanted to.
Mhm.
Thank you very much.
Lisa, what do you got?
So currently the renewal that we're doing at Porter Stark is for the chronically homeless. I would like to add literally homeless to our permanent supportive housing offerings. We are trying to find our original grant application, which apparently goes back to the mid-teens, to see what we did. But we are thinking that we probably originally asked for chronically homeless only. So I'm wondering, would we then have to make this separate and new project and say now we would like to do literally homeless as well? Do we transition it and say we're doing all literally homeless so we can sort of do the whole gamut? How would we handle that?
What would you recommend, Howard?
If it's permanent supportive housing that we're talking about, the only eligible populations for new project funding that can be served are either the chronically homeless or the dedicated plus population. And the only time that you can go serve a broader population is when there are literally no chronically homeless people on the coordinated entry list, in which case then you can move down to the next level of vulnerability, as it were, on the list. But as long as there are people who would meet the dedicated plus or the chronically homeless definition, they'd have to be admitted first to the project.
Oh, okay. So basically, if I'm going down the CE list and I've gotten through all the chronically homeless, then I can do literally homeless regardless. I don't need a grant that says that. I just am moving down. Oh, I did not understand that in the rules.
HUD says very clearly they don't want you to leave a unit open because you're waiting for a an eligible chronically homeless person to appear. They want you to always prioritize those folks. So if they are on the priority list, they're going to get the housing. But if you have succeeded in, address those needs, then you want to serve the next highest need.
I totally get it now. Thank you so much, sir.
That's a good question, Lisa. Okay, so I am in the grants portal. Hi, Hannah. Yeah, no, thanks for that. I'll answer this question before I hop in case anyone has to hop off. So Hannah just asked a question in the chat. Does this have to be a formal letter or an email? If you go to the IHTDA website, I'll post the link here now. It explains kind of what we're looking for in the letter. It can be in an email format. It doesn't need to be. I'm not asking it for an agency letterhead. I think the example I gave might have been, but it certainly doesn't need to be. But there is a request for application detailed document that really dives into the nitty gritty of quite a bit of things and it also offers kind of a sample of what you could include in your letter. Really, we're just looking for, an approximate budget, where is the project going to be located? What's your agency contact info? This is especially important because our new system, if you don't have, if there are any issues with it, then we need to be able to look at the account access. And so part of that is helping set you up with an account in the new system before you apply. So That's one of the main reasons why we're having folks do this, is because we've had some snafus with the new system, and we just want to really make sure that we get the application account set up correct, and that folks access that easily, so we know who's applying and can support them if they're having trouble getting in there. If you are a current recipient of CoC funding, similar to what you did on your renewal project, you will go to the Access Indiana system, and this is also true once you get your account set up with us after you submit your letter of interest. You'll be able to see in that Access Indiana system the community services grants portal. And when you log in, if you are a renewal, you'll see something that looks very similar to before, but now it's a little bit prettier. And you're actually going to see, once you're given access to the portal, this new application portal. And we're going to go over here to CoC, our Continuum of Care CD 2023. And it has a program description, and we just got the funding amount, so I need to let them know that new amount, but we're going to go ahead and hit apply now. And the first little box that's going to pop up is ask me for my project name. I'm just typing in some basic information. So we're going to put that in there, and it's going to get us started into a portal. If you go to the IHCDI website, you're going to see the last page of that RFA is an overview of the kinds of questions and the point values associated with those questions in the application tool. So if, as you're completing the application, you want to know what points are going towards what categories of these listed materials, you can go and find that information there. There's not detailed points descriptions already on this portion of the application. So the wonderful thing about this application process is that you can have more than one person working on the application. You can come back in, as long as you've hit save, you can come back in and access this application over and over and over again until you're ready to submit it. So you by no means have to be ready and sit down and do all of it at once. The main thing is you just need to hit save if you want something to save. Otherwise, if it times you out, if you leave your desk for 2 hours and you come back, it maybe won't have saved the specific page you were working on, but anything else that you saved, it would do that. It's gonna ask you for applicant information. This is basic information about your organization and your UEI, your location, what congressional district are you in, so you may need to Google that. Things like that. Then there's going to be project information. We'll jump into this box in a second, but I'm just going to kind of do a basic overview. Eligibility questions and general questions about the project. Specific information about the project funding, how funding is going to get used, how partners and you have experience in working with funding. And then we get into some more detailed questions about your project type, your compliance with the model of that project, how the project will be set up and designed, housing first, healthcare and housing partnerships, and then some bonus questions. So this is, I wish it was shorter, but it's not. And the eSNAPS application is also not a short application. So just know that in as many ways as we could, we tried to tie questions back to the eSNAPS application so that if you are selected to move that project into eSNAPS, you have pretty much already written a lot of your answers to the application when you move it into the other platform. So I kind of mentioned this before. This is basic information about your project. You're going to list out who you are, all of your information, what kind of organization you are. A little bit more detail about that. We're trying to collect more information about who our partners are, so appreciate your help in that. This will especially be important for your contracting process. So we need to know who the contract will be held with and so forth. I'm in a test account, so some of this information is already filled out and looking a little funky, but it's there. And then you're going to want to obviously indicate that you are in good standing with Secretary of State. And that once you hit next, so that next will save your status and take you on, it'll close that page and take you to the next page, which will, or take you back to this page, which will take you here to project information. Again, so this is already auto-filling my original response. And so you could add more details there if you wanted to. Again, your county and your congressional district, I'll just throw one in here and we'll be in 3. So you can see the next section. So this is going to ask you about the kinds of folks you're going to be serving in your project. Are you serving unsheltered, youth, young adults, chronically homeless? If you'd be willing to serve all of this population, then you just hit going to serve all. So that's the nice thing about this, and you have selected that. If you are not going to serve a population, but you are serving some, you can hit NA on these and have that selected for you. So then you can go ahead and answer questions about, did you participate in point in time count? What was your utilization on your beds, and so on and so forth. And if these don't apply to you, then you just list 0. So if you didn't have those, then, if you didn't have those types of projects, and then you could obviously describe, the kind of program that you are and which ones fit with you. Are you going to provide these types of services? Yes or no? We'll just hit yes here. And then we're going to say we are going to provide SOAR assistance and we have completed training. Go ahead and hit next. So this is where you can list out different types of services that your agency is going to be providing, or whether or not you're going to have another person provide it. Now, it's important to know that as you fill this out, if you list that you as the applicant are going to be doing something, this is not true in our application, but it is true in eSNAP. So as we transfer stuff over, if you list that you're going to be doing something, it's going to want to see budget lines in those areas. So just know, it's, you guys are obviously operate with your best information you have as you go to complete this, but it's got this listing because this is exactly how eSNAPs asks you this exact same information. And so we're just trying to collect it from you now, especially if you're going to apply under IHCDA, so that we don't have to come back and ask you for it later. Eligibility questions. Have you received a grant before? This is not, you don't get discredited or kicked out if you haven't, but if we are looking to know whether or not you have that experience. Do you serve survivors of domestic violence? Did you participate in a regional planning council? Are there people on your board of staff that have recent experience of homelessness, housing first, and some housing first questions related to how you provide services, and also whether or not you're ensuring that folks have access to educational services and non-discriminatory. If at any point you're completing the application and you're like, I don't know about these, I'm just going to click out of it, and you can't get out because you want to hit next and it's not letting you, you can always just X out of the section. It won't save any answers you provide if you use that X though. I'm going to go over here to project funding, because this is where you're going to get asked about match. This is going to be where you get asked about whether or not you have any compliance issues with your grant or with HUD. If you have any findings, how you keep your books and things. And again, I'm in a test account, so some of this looks kind of scary in red, but it shouldn't look scary in red to you. And also, if you need some more detailed information about what something is, this will automatically appear for you if there's an error on your response. Okay. The project type and compliance here. So are you applying as a subrecipient of IHCDA? If you're applying as a subrecipient of IHCDA, then you will be contracting with IHCDA, not directly with HUD. So if that's your plan, then you hit yes. If you would like to contract directly with HUD, you would hit no. If you don't know what you want to do, reach out to us and we're happy to talk to you about it. It's ultimately your organization's decision about what you'd like to do. Then you've got your project types and how you'd be applying. Am I going to follow written standards? Yes. And some questions about your ability to complete required activities like submitting agreements, timely submission of reports, and all of that. All right. Then we get down here into setup, and this is a kind of a funky one I wanted to make sure I hit on, because this is another chart that's taken directly from the eSNAPs application. So here is a chart that essentially asks you to detail out the number of days from the day your grant is executed to when you would hire staff, enroll participants, get folks occupying units, have all your units leased. And then if you were to be wanting to use funding to purchase land, structures, all of that, if that's part of what your project design is ultimately going to be, then you would also include that there. Usually, we have very few applicants that usually fill out these lines. Everything's zero until you fill it in. But this is a chart taken directly, again, from eSnaps that we're asking you to complete for us so we can get that information over into that system. Are you requesting construction costs? You'll be able to detail that. Are you going to be contracting any funds to a subrecipient? If you are going to be contracting funds to a subrecipient, we're going to need a copy of that agreement between the two parties so that we know that you are in a formal relationship with them. If you're going to be using somebody else's match, you'll be obviously providing match documentation. They're not a subrecipient. You're not subcontracting anything to anybody else if they're being used as match. We're going to ask you here then to talk about how, in a narrative form, how you're going to be providing services to maintain and attain permanent housing, how you're going to integrate with other service providers, especially mainstream healthcare. Are you going to make sure you're following up with people, track enrollments, track increases in income? This here is particularly important as we talk to HUD about performance. When you are receiving CoC funds, you are evaluated on the number of participants who get income and the number of people who are who retain housing and things like that. So there's also some questions here about engaging with clients and how you're going to engage and train staff to make sure that people experiencing disparity are served well. The last couple sections here is related to Housing First. So there's some questions here about Housing First and client termination. I'm just going to answer these so we can go through the other sections. No, wait. The last two sections here are related to the housing structure and healthcare partnerships. If you answer no, but think that you'll be able to get it later, again, please reach out to us in an email and we can start working with you on how you might be able to get that documentation by the time we submit to HUD. If you answer yes, it's going to ask you for some more information about the entity. So I'm just filling in text so you can see it, but it's going to want some more information there. There we go. Everybody knows this pain, right? Okay. And then the last section is this one is about equity and representation. Are you training staff and do you track outcomes for folks so that would be something you could do in the future? And then hit next, and that's going to save all those sections. And you're actually going to see when you've gone through a whole section and saved it all, that it's going to list the status as complete. You can still go back and update it until you hit submit. We've got bonus and budget and uploads at the end. Once all of these sections say complete, you'll be offered a button up at the top that says submit. So you can't submit until you have completed the sections. I'd like to quickly look at the budget. So a couple of questions I've gotten in the past are, how do I know how much to ask for? That's really up to you. HUD is going to base this budget for you, and maybe I should start there. They're really going to base the budget on they're really going to base the budget on the rental assistance. Sorry, I clicked on the wrong one, so I was trying to get back. So what it's going to ask you to do in this system is request rental assistance. So that's kind of the base of your budget, is how many units you're going to be serving in the project. And then from there, the service dollars, the other funds are really up to you. Now, all of these buckets are here for you, but they're only eligible under certain types of programmatic types. So if I'm operating a rapid rehousing only project, operating costs are not something that I'm eligible to apply for. So again, this is another reason why we want to make sure we know that you're applying so we can help guide you through this process so you don't inadvertently apply for funding you're not eligible to receive. The rental assistance, though, does calculate from the location. So I look for 1-bedroom units in Adams County, and I'm gonna look for 5 of them there, and it will save and hopefully should do the math for me. We were working on this for a while. So it'll let you add those units in, and then when you go to next, it's gonna take you here. Oh, that was weird. I might need to talk to them about this because that didn't appear last time we did that. It should, anyway, it should calculate a budget for you that you'll see later in the document. And I'll ask Alan about that. But the unit types here down at the bottom, like I was filling out before. Again, this is information that's in the NOFO. You're gonna see it, or excuse me, in the application, you're gonna see that and complete those. If you are a scattered site location, you're gonna use your administrative offices for that address. Okay. So the budget is probably the longest single section. And like I said, it also, it does have the rental assistance that should calculate. I'm gonna double check that that's working properly, but it was working the other day, so I'm not sure what the snafu is now. If you are providing, well, when you are providing your information about your sources of match, your options are cash and in kind, and government or private. So government would be another governmental grant. It's not specific as to you know, any type of particular grant, but you're going to want to make sure it's eligible for match before you include it. Again, the information about whether or not your funding is eligible for CoC match is something we can help you identify, but there's also information about, you know, eligible match in the notice if you need to take a look at it, or you can check with your funder on whether or not those funds are eligible to be used as match. The main thing as you're thinking about match is that match has to come from an eligible source. So it can't be ineligible, like you can't use CoC funds to match CoC grants. And then it has to be spent on eligible activities. So this would be funding that's coming in to serve the grant for things that the grant can also pay for. It's just extending the support the grant can provide. So I'm not going to go through and do all these because that'll take us a really long time. And I know we're coming up on time here, but I did want to give y'all a chance to see it. Like I said, you can come in here and look at all of this and poke around. You can change anything up until the day you hit submit. And if you're having any difficulty with the system, reach out to us. We've been providing technical assistance on the system since we got it last month. So we've got some developers we're working with. Our team has gotten pretty savvy with the system. Overall, we've had, you know, really good feedback that people like it and that it's fairly, you know, intuitive to use and easy to use, but I'm not going to pretend like this isn't a short application. This is not a short application. So, you know, take your time with it. And if we need to support you in any way, that's what we're here to do. All right, I'll leave it open now for any further questions.
Yes, Rachel, it's Eric Tilkmeyer with Echo Housing in Evansville. On the budget page, you said that certain categories were only available based on project type or program type.
Mm-hmm. Will
those automatically be disabled if they're not available for the type of project that you indicated?
I have Alan on here, so I might defer to Alan. Alan's one of our developers. He's been listening in today. Alan, will those be disabled for folks, or will we just have to advise people not to complete those sections if they're ineligible?
Yeah, I'm probably just gonna have to circle back. It's been a minute since I've looked at that logic. So yeah, let's gather that question and then we can circle back on an answer for that.
Yeah.
So if not, where would we get that answer, Rachel?
Oh, sure. You can definitely directly ask us, but there's all the line items and what's eligible under each program type are in the regulations for the program. So I can let me go grab them really fast and put them in the chat. But really, if for supportive housing, you guys have a lot of options on which line items you pick there and how you structure the project. So you're going to have more choices than a rapid rehousing project will have. So it's just operates a little bit differently.
Okay, thank you.
Rachel, this is Eldon Solomon from the Journey Home. I have a question, just a clarification question. That portal that you just reviewed, is that are we allowed to review that now prior to submitting the letter, or is that going to be released after the letter? When do we
the way we have it set up right now is that we'll get you, we'll set you up an account once you send the letter. If you would
Okay.
just like an account, Eldon, because you want to take a look at it, that's okay. I totally understand that. Reach out to us and we'll set something up for you. If you guys decide to apply, then you decide to apply. It was more because prior to about a week and a half ago, there was some other issues kind of going on with the system. So we kind of had to release the letter, the whole RFA process, not knowing exactly where things would land on access to those accounts. So if you just want to shoot me your name and your email, I'll set you up with an account. You can take a look. And if that's true of anybody else, just shoot an email to community services and we can set it up so you can decide if you want to apply by taking a look.
And that access to you is in the same email that you sent the notice for the letter and.
Yeah, if you email that, it'll get to us.
Okay, thank you.
Yeah, thank you. All right, any other questions? I'm going to go ahead and turn off the recording. I'll stay on for a couple of minutes if anybody needs anything. Appreciate your time today. I was really hoping that by the time we got to today, might have released a little bit more information on a couple of things. So, stay tuned for more. We might release some guidance on some of those new line items. But as it stands right now, we've shared as much as we know with you, and we hope that this is helpful to your decision-making process. And as always, don't hesitate to reach out to the community services inbox. And we are more than happy to take any of your questions. And certainly also talk more with you about the application process, the application tool, all of those things we're more than happy to chat about. And I just hope everybody has a great afternoon. Thank you.